mental health awareness program under the International Voluntary Mental Health Organization. So I once again welcome you all. On the behalf of IVMHO, today we are joining to commemorate the World Mental Health Day on the theme Mental Health at Work. We are uniting with stakeholders, tackling issues and diverse breaking stigma and discussing the challenges associated with mental health support, training on PFA, that is psychological first aid, training on mental health and psychosocial support, MHPSS, and promoting mental health disorders prevention by early interventions. Underlining this importance of the above and addressing these issues of challenges, partnership and collaboration, vulnerable groups including the young people, the elderly, the youth, and the affected people by crisis, the Ministry of Health, psychologists, caregivers, volunteers, psychiatrists, doctors, and nurses alone cannot reduce the mental health burden in our society effectively. This is why we deem it necessary as an organization to call up this responsibility to gather all stakeholders so that we can come here, look for challenges and ways forward. Uh, these issues has joint effort from all stakeholders who are here present and those stakeholders who are not here present today in this gathering, all supposed to have this message sent to them so that we can have a joint collaboration effort to mitigate mental health issues surrounding us. This event could not have been possible without the partnership of the British High Commissioner, who are the key sponsors of this event, and the presence of the guest speakers, the able facilitators, the IVMHO volunteers, who have been working tirelessly very well to make sure that this event is well hosted, and all organizations here present and our partners as well, and the media. So we would like to thank you all for coming, and we hope you have a successful and a very enjoyable training ahead. Thank you very much.
So I was able to gather a little information about each of their backgrounds to make sure we know the people that we have, even though they are not much in the system, but we give them the importance of being where they are today. So I'll start with Bakari Kamara. Bakari has a bachelor's degree in registered nurse in the Gambia. He also has a BSc in mental health.
The board management of Edible Francis Small Teaching Hospital, because Tanka is under them and where I am currently working with. So we cannot go without them or without giving them the credit. So I will say a big thank and shout out to all of them on behalf of them too. Okay. International Voluntary for International Mental Health Organization. This is something that is very great for us. This is not the first time of us having these things with them. They have been doing it, and we are always seeing it, especially for us at the treatment center, the Tanka Psychiatric Hospital, where they always come on occasions, especially on Saturdays and the likes. So, but now, this is a team. The team says mental health at workplace. It is something that is very crucial. It was a team sometimes back around 2020 or 2029, something like that, by WHO. And this year again, the same thing repeats itself again. Mental health at workplace. Why do you think that it is repeated? Because there are so many things that are very important in our working place. One, we could all run into fatigue when we are at work. We can have work overload, a lot of stresses in our works. So all those things, WHO has sit down and take expert on technicals, have sit down and then find out that these are something that is that are always disturbing people at workplace. You will see somebody, you are there with working with somebody, and just of a sudden you fail to see that passing or performing up to its own expectation. So there must be something underlying causes of that. So what is that? It's either this mental health at workplace, and then the so-called bureaucracy people are having at workplace, where we see our own managers will be start suppressing us or bombing us with a lot of works and whatsoever we are to do, or tax given to us at workplace. So in that, we as an employee or we as an employer, we need to look at that. So that is what exactly WHO has looked at, and then this is the second time it is repeating, because it's alarming, because you are even seeing, I know, some employers become so depressed at work to an extent that even committing suicide, killing themselves, not because of they don't have no work to do, others, or not because of they are not being paid for salary. No, others are having very excessive salary, but then what's bothered them or what triggers their these activities running into mental health is due to these certain activities. We should, in as much as we are working, we need to look after ourselves. It's also crucial in our workplace. Both our employers and employees should all look into it. So this is something that is very, very crucial, and we will see it during our course of interactions with our facilitators, where they will talk us through the mental health at workplace. So they will tell us what directly we will face and the challenges people are facing as an employer or as an employee being in that institution. So what is expected of us is exactly we're going to see today. So I know all of us are here. It is something that is very crucial, and let's listen carefully again. I always want to say this. Mental health, nobody is immune to it. There is no vaccine for mental health. And there is nobody who can beat his or her chest by saying that, look, I cannot have mental health, or I cannot run down into mental illnesses. No, nobody can say that. Whether you are the president, whether you are the most richest somebody, whether you are the whatsoever, you are not immune. Take it from me. You either be anxious, or be stressed, or so many things will come into it. But then, in as much as you can revive yourself to come back, then you become a so-called normal person instead of the normal person. Because there is no human being who is 100% mentally fit and mentally healthy. No. We all go into it in one day or the other, or in one way or the other. Even running into this traffic or whatsoever, you become stressed because you are running after a certain program that is very, very important to you, and time is not with you by your side. So all what you do is you become so burnt out, you become stressed, you become depressed, and you become down. And it will be unfortunate when you reach to that place and they'll tell you, sorry, we have gone far. We are not interested anymore. So you see what happened? Absolutely, your mood will go down. Pam. So when your mood goes down, what happened? So those memories you are having, or you having the zeal that yes, you are the potential candidate to be there. So up to an extent that it becomes negative for you. So maybe that is your hope, that if you go into it, you may be able to award that program or whatsoever that is there. So for that being the case, we are saying mental health is something that is very, very crucial. We need to look at ourselves and then look at it others too, mentally. So having said that, I will thank once again the International Voluntary for Mental Health Organization too, honestly. And I will thank the mass media too for them hosting this. This is a mental health, World Mental Day celebration, where the whole world is celebrating this day. It marks and it unites, it educates. So this month will continue. The whole of October will be a series of activities on mental health. That will do, and then without leaving the International Voluntary Mental Health volunteers and organizations too, because they are key players in this. Looking at how many associations do we have, or how many organizations do we have, and here they are the only people addressing it this year. Last year they were together with us at Tanka Tanka. That's where we celebrated it. But this year they are the one inviting us. So you see how it is now. So we take it as a good partner. So we are saying a big thank you and a big shout out to you all, and then big shout out to the mass media who are putting it out there for us, for the general population to see how is mental health affecting people at workplace. It's something very crucial. Okay? In that note, I will say, without wasting much time, we are behind schedule. So thank you so much, and then welcome for all of you, or I'll welcome all of you on board. And then let's see our facilitators, how they're going to elaborate to us. Okay.
So I will not do the session like the fullers will do and the serial. So I want it to be fun and lively. So since we have some minutes left before we invite Lamarana Jallo, I think, yes. Yes, Lamarana Ba, but still in the categories of fullers, right? So what I'm going to do is I would like the audience also to fill in themselves to participate in the session as well. So I want it to be participatory. So unfortunately, we do not have Q&As, but since we have a couple of minutes, like let's say 5 to 10 minutes left before we invite the next speaker, I would like if the audience have questions relating to mental health in workplace or anything that is related to what you want to know about your well-being, we can throw out questions to Mr. Kamara. I think it's very important that we speak, because we are here to promote that being able to speak out is very important and is necessary. So anything that you think you want to know, they are here for us. And this event is necessary that we share our thoughts, and I'm sure they get the answers to any question that we may ask. So you can feel free to ask any question before we invite another one, please. Do not let me down. We are here for one thing, and that is our mental well-being. Everybody wants to be free in any environment they find themselves, isn't it?
I think it's better to give more place to command. Otherwise, it's
Really?
I see that. Not worry.
So feel free to ask questions. I think we have time before we invite another speaker, please.
Also have the plan. It's already written in our order. If this one fails, I'm going to include this. If this one fails, I'm going to do this. So this is why when somebody goes, sleep. If you cannot sleep, please you have. Human being, we need sleep. It all boils down to what? Suicide.
Thank you so much.
World Mental Health Day. Right now we are at the Shaka display. The way we tackle our patient and the way we deal our patient is so interesting, so important. Now, any health sector in this country, mental health, how we deal with our patient, Canopy General Hospital is number one. The way we approach our patient, the way we take care of our patient, and the way we treat our patient. If you have any problem, any mental health problem, or your family is having problems, bring them at the hospital. We know how to handle them. We will talk to them and make a psychotherapy properly. And before that patient will leave us, you as an escort or you as a relative, you will become very happy about the way we treat your patient. And at the hospital level, we don't inject patients to be harmful or to suffer. No. Health sector, we have sympathy. Health sector, we know how to deal with our patients. Because somebody coming with his pain in the hospital, you cannot give that pain passive. While he is complaining about headache, you use Lagatin or Modicare. Cannot tell well. But what I wanted just to tell you, mental health at the Canopy Hospital. Anyway, sometimes you become surprised. Any workshop, we at the mental health, we are not invited. Because we are the people who know much about the health problem. Just recently, we have this epilepsy survey. They invite other people, different places, and leave us at the clinic level. I think clinic level they should tell them what is epilepsy and how many patients we are receiving at a day. Well, I'm sorry to mention that word, but this is my idea. Any program you have concerning about health, please inform the clinic. I think clinics should give you feedback what is going on. Thank you.
They gave me the wrong medication. And thank God I was able to read from the reports. This is matching, because report says the BP is good. So they are giving me additional blood serum for me to give the child. So I have to report it because I was able to read what the report says. So these things happen, not all the time, but it happens to these young nurses, and they are all trained, but because the patient and also the determination they could have towards the job. So it's two-sided. But anyway, thank you so much for that insight. Yes. So we will dive into.
Mr. Amadou Diallo, and right now I'm a senior member of the Canoping General Hospital and then in charge of the clinic. Of course, I do other things, but I don't think they are very significant because I think some of my students are here. I also do some part-time lecturing. Of course, today we are here to celebrate World Mental Health Day, but we just don't want to do the march past, which was done actually, because some people came up and then did that, but this thing, SAF, they call it International Voluntary Mental Health Organization. It's long for me. In those days, SAF was easier for me. But they've come up with this now, to bring in stakeholders, the key players in mental health in the Gambia here. We all have our roles to play, and then we are all having the same goal, that is to improve the well-being of the people that are living with mental health conditions and then the population of the Gambia at large. This chapter we are looking at today, mental health at workplace, is very important. People are going through a lot at workplace, either you like it or not. And then looking at my background, my master's is on occupational and environmental health. When you ask that questions, I kept quiet because I know I will have my turn. I just don't want to preempt. You know, in certain settings, especially where I schooled, where I did my master's, in every institution where you have 50 workers, there will be one safety officer. And this safety officer is to look at the physical, chemical, biological, psychological factors that can affect the workers in that place and see how best to prevent them from having those problems or having injuries or any, disturbance or harm from those factors. Now, looking at our healthcare setting, on daily basis, nurses will be having lacerations when breaking ampoules. I'm telling you, on daily basis it's there. And now, even to have simple thing, an ampoule breaker is not there. Just to break the ampoule. So you see, sometimes nurses will wrap the ampoule and hit it. It's not professional. But if you don't do it, you hurt yourself. And who cares? No one. Because when I came back, this was the first thing I said. And I was told MRC have it. You know, we try to make calls through MRC. Up to date, we don't have it. What can I do? Even when I came back, in those days, within a week, one of the doctors, I saw the hand being, plastered. I asked what happened. He said, an ampoule hurt me. I told my people, this is what I was saying. As simple as ampoule breaker, which should happen. When COVID-19 came in, then I was here with my boss, Pasong, and others. You know, we are the first people to be redeployed to the quarantine centers when the first planes were coming. So imagine now, COVID-19 is just imagine, it's coming. And in those days, Italy, people were dying on a daily basis. You know, in tens of thousands or hundreds, you may call it. And now COVID-19 is coming. We don't know much about COVID-19. And now we are asked, go and be with those patients that are suspected or confirmed cases. Now imagine that psychological trauma going in. The first thing I did, or many of us do, is to send our families away. I sent my family away. Then I went to the hotel. Which means now I am ready for everything. But psychologically, do I have anyone to talk to me? At least to comfort me? Do I have anyone to explain that this is the risk factor here, this is what you can do on daily basis, let there be debriefing, we know what's happening, what is unfolding, and the like. But he is here, you go there, you are on your own. You go there, you are on your own. My boss used to tell us, Pastor, that in any situations, the securities and nurses are sacrificed. When war comes, we are sent. Anything that happens, we are at the forefront. So which means we are here to serve and die for the people. This is it. Anything that comes, we must face. But now, mental well at workplace, this occupational and safety unit, of course, there's a unit in the country, but it's not functional. because there is no policy, or let's say, a document that will guide the practice. The unit is there and it's headed by someone, I know the person, but when I contacted him, this is exactly what he told me. So I think we have a long way to go in which there need to be forced a document. It's just like you have the traditional treatment. We have the program at the Ministry of Health, but is it functional? No, because there is no document, there is no legal document to work with. So it cannot function. The same thing happens to occupational and environmental health. So this is why you don't see them very active. But in our position, even at the hospital, the position is there. There is no hospital that the position is not there. It's there, but priority is not given. And then, it's not like a clear condition. There is no one saying, if you don't have it, we are going to close your hospital or we are going to charge the hospital. It's not there because the document to dictate that is not yet ready. This is why we don't have it. Do you understand? So now, today I am here to deliver on psychological first aid. I know there are many, voluntary organizations here. And then psychological first aid is something that is not new. Either you are doing formally or informally, but you are doing it. Do you understand? And most of you have gone through it. But of course, it is unfortunate sometimes it is done in a way that it harms patients or it harms the victims. I will give you an example now. If there is an accident here, like let's say road traffic accident, the first thing you are worried about is your goods, your mobile phone, your money. Those coming, instead of helping you, they are stealing it. And those people coming first are the people who should give you that support, that psychological first aid. But it's the opposite. Most of the time an accident happens, your belongings are gone. Is that what we are talking about? Thank you. The other problem. Now they advertise you. They just take pictures and then send it online. Is it helping? They don't want you to even, there's no privacy, there's no confidentiality. You doing that, it's not professional. If at all we are in another era, of course nowadays we see people are being sued on a daily basis because of defamations and so many other things. So we have to be careful, like this social media and everything, we have to be very careful. Do you understand? So, it will be interactive. This is why I'm just being, bothered with these cameras. I don't like this thing, mics here. But of course, now, who can tell me what is psychological first aid? I know we've trained people on this, and people have been doing it. And I know there are other people here that have even taught people on psychological first aid. I just want to know, like from the background, is there anyone who can volunteer and tell the people what does he or she understand by the word psychological first aid? What does it mean? Yes, lady, go ahead. Mm-hmm. The first? Who's in need? Thank you. Anyone else? Yes, lady, go ahead.
Okay, these are mechanisms that are used to reduce the risk ahead. Instead, an example, like if someone has an accident and you have, so the first aid that the first time he or she are mechanisms that will have in order when he goes to like the hospital will find any more risky when it comes to the treatment or whatsoever or losing blood or whatever. So it's like a mechanism used to ensure that the risk factors ahead are minimized.
Okay, fine.
Are you asking for what is first aid or psychological first aid?
Psychological first aid. Maybe now you understand the question and you know what it means. Now talk. Tell us what is your version of psychological first aid?
Yeah, I think it's the first help or assistance that you've given to someone who needs psychological support.
Who needs psychological support?
Yeah.
Okay. So it's the first thing you give. So who are those people that need psychological support?
almost everybody.
Almost all. Almost everybody. Yes, go ahead.
If I should understand your question very well, this would mean first step you should take to understand when somebody has that psychological issue, how to prepare, how to help the individual.
Yes. One thing I, in fact, forgot or asked the moderator to do is like the introduction of the various organizations here. Of course, I have to give credit to certain organizations. I work at Canterbury Hospital, and there are certain organizations that are doing extremely well. Or maybe perhaps we are working directly with them. I know everyone is doing well, but these people, we are working directly with them, and then we see how they have direct impact on patients. Because they bring patients, and some of the patients, they buy medication for them, which is, of course, a big challenge for us, the medication for the patients. Most patients don't have it, and then it is unfortunate, like family members at some point don't support their loved ones. They leave them. And, if the patient was someone who is healthy, wealthy in America, you and I will not know the patient, right? But why is it that when the patient is sick now, you give it to the, healthcare workers? It's unfair, it's not justice. Family members should take your loved one. Whatsoever happened, come rain, come sunshine, it's your blood. But it's the opposite we are seeing here. Any patient, this is what we are seeing. But we have certain institutions that are working directly with us, and then make sure like they bring those patients, or in fact buy medication to support those patients. And we are very grateful. But I know Hemda is here. Hemda happened to me. Okay, this escaped my mind. That 2 weeks ago, a patient was referred to us through, is it SARS? I don't know, SARS. SARS, I don't know, SARS, something like that. It's SAR something. Boy, I was, planning to investigate or find out who are these people. Up to date, I don't know actually who are SARS. But HEMDA do bring patients for us. And then I listened to one of your programs. Very insightful. And then it's like you are doing psychological first aid. Because imagine someone who is not like a trained professional on mental health, going to the street to support someone who is living with mental health condition. Let's say who is psychotic. He might be aggressive, poor personal hygiene. Everything is there, and now you are not a trained professional. Now, how do you approach this person? You can see the psychological distress, or let's say, the sacrifice that some people are doing. It's not an easy. Even if it is your loved one, your close one that you know, sometimes to approach such patients is difficult. Because we know, you cannot say all psychiatric patients are aggressive. But aggression is among the signs and symptoms of psychosis. It's there, either you like it or not. So now you put that at the back of your mind, you go there. Do you know how many of our nurses are attacked by patients? It happens. Some of them sustain injuries. Now it means you are going there, and at the back of your mind, you expect to have those problems. So it's a big sacrifice we are doing. Of course, he said the emergency exit at the psychiatric clinic there. You see, let me tell you, it is unfortunate. You go to many of these psychiatric centers, we don't have emergency exit. But when we started in 2018, the clinic there was not even a psychiatric clinic. But we managed to push. We evolved. In those days, it was put under, this thing, outpatient department, and then there were specific days for the clinic. But we have to push the agenda that the service, the demand is there. There needs to be a full-fledged clinic wherein patients will access services on daily basis. And we did that, we pushed the agenda. We were given a place. In that place, some of you know, we create an emergency exit. This other place we moved there a few months ago because now we need to expand the clinic. The demand is high. We have the psychologists coming. You have the psychiatrist doctor there, and you have students coming almost every week. So we need to expand this. So this is why we moved to another room. So, but we are still working on it. Already the management is engaged to remove an emergency exit, and in fact, to demarcate the room so that we can have a counseling session separate from the consultation room. So I mean, working on is on progress, and then I think in the next few months to come, that will be a thing of the past. We will have an emergency exit, inshallah.